you earlier about the Supreme Court hearing on the health care law. It was passed 2 years ago to help the nearly 50 million uninsured Americans. Nowhere is that a bigger issue than in Texas, where nearly a quarter of the residents lack coverage. Ben Tracy met a nurse there with her own plan to help.
Pick up your pretty little feet for me, darling.
9-year-old Georgia Shivers had a big wood splinter lodged in her foot.
Hold mommy's hand really, really tight.
A visit to a doctor was not an option. Her mom, Christy, does not have health insurance. It would cost her $400 per month.
That's my girl.
We need groceries and, pay bills and insurance. This is too much right now. So I was going, we're going to have to go to the emergency room for this because there was nowhere to go.
Her best alternative was here, in this Houston area strip mall.
On most days, how many patients are you seeing?
Right now, actually, I'm averaging anywhere between 15 to 20 patients.
Melissa Herpel opened this unique clinic last June to provide care for those without insurance. The 31-year-old nurse practitioner is allowed to do almost everything a general practitioner can do, except deliver a baby.
When you think of, uninsured, you think of poor, you think of low income, you think of, a tiny shack house, with somebody who's got no amenities. That's not the case anymore. How's everything going? I kind of noticed I bridged that gap for those patients. I was able to be that in between so that they could get the care that they needed before, emergency or disaster struck.
Herpel financed the clinic herself. The office staff includes both her parents. She charges just $50 per visit and near wholesale prices for medicine. This antibiotic costs her $2.
And what do you charge for an injection?
I charge $15.
What would that be if someone went to a doctor's office?
$95 to $105.
And why the difference?
Insurance.
The Texas Academy of Family Physicians says an emergency room visit for Georgia's splinter would have cost as much as $900.
And when the uninsured end up here in the ER, their costs are passed on to paying customers. That means insurance companies end up paying more, so they raise rates, and fewer people can afford health insurance.
And fewer businesses. Less than half of Texans get health coverage from their employer, a problem Melissa Herpel knows well.
I don't have insurance. I can't afford it for myself. It's at least $200 every 2 weeks. I can't afford that right now. And because of that, I don't have insurance.
And the problem keeps growing. Herpel saw 183 patients last week, the most since she opened her clinic doors.
Bye, thank you.
Ben Tracy, CBS News, Houston.